bit more about emotions and breast health. Actually, before we started this video, you said something about you wanted to change Breast Cancer Awareness Month to Breast
Wellness Month. That is what we call October. We don't subscribe to the breast. We don't want to be more aware of breast cancer. We want to be more aware of prevention and wellness.
Because what we think about expands, what we think about
Correct.
Increases. Okay, so talk a little bit about, I think when I came in March, you said something about grief, anger, and resentment being the three big emotional flags or the emotional risk factors.
Correct.
Emotional risk factors for breast cancer. So tell us a little bit about what you see there.
Well, this came actually from a practitioner that we worked with for several years. He just passed away last year. He was 82 years old. He lived in San Diego, and he was a naturopathic doctor for many years. But he was an amazing healer, worked with thousands and thousands of breast cancer patients, as well as other patients that had stage 4 cancers. And what he told us when we first met with him is there's two characteristics that all breast cancer patients have. Number one, they have chronic daily stress in their life.
Chronic daily stress. Okay.
With no or very little self-care.
No or very little self-care. So let's stop there for a second. What does that mean? No or very little self-care? That they don't
give themselves downtime.
Okay.
They don't give themselves time to relax.
Okay.
They don't give themselves time to do nothing. You know that old nothing? Don't just sit there, do nothing?
Or it's like in Italy, they talk about il bel far niente, the beautiful doing nothing.
Yes.
Okay.
In addition to taking care of everybody in their life except themselves.
Yes, I see that
Let me tell you one story.
Okay.
I have a patient who we've seen for several years now. Her scan kept getting hotter and hotter and hotter. She finally went in and had additional screening done, found out she did have breast cancer. She's doing fine now.
Good.
And I asked her the last time she came in for her baseline after her surgery. I said, what have you learned? What is the one thing you've learned from this experience? And she looked at me and she said, you know, when I found out I had breast cancer, I was number 23 on my list in my life.
Wow.
She said, for the first time in my life, I'm number 1. And she's 69 years old, and it took her 69 years and breast cancer to remind her that she needed to take care of herself first. It's like they say on the airplanes, you got to put your own oxygen mask on first, or else you can't help anybody else. Yeah. So that's really what we focus on with our patients. We talk about self-care more than we talk about food, more than we talk about exercise, more than we talk about bras, and we discuss all of that.
Yeah.
But the self-care piece is the most important aspect of how a woman can heal herself and how a woman can help prevent breast cancer in the future.
Wow, that's interesting, because when I think about self-care, I mean, I see this a lot in my tapping practice, where I will talk with women who have had breast cancer, and, you know, let's say they're struggling with their weight, they're struggling with their body image, but people-pleasing being a huge
you got it.
obstacle. Again, putting oneself 23rd on the list. So that actually makes me think about the physiology of the emotions and the energetics of the emotions, and how that, because if I'm 23rd on the list and I've got 22 people ahead of me and all of their needs matter more than mine, sooner or later I'm going to be pretty mad about that. Sooner or later I'm going to get upset. Where does that upset go? Where does that anger go? Now, physiologically, in Chinese medicine, anger is connected to the liver. Yes, that's right. And kidneys are connected to fear. So, and the fear aspect of that being the fear of speaking up, the fear of asserting, the fear of taking time for oneself. So all of the energetics of those emotions, what I'm hearing you say, register in the cell tissue and then show up. How does it actually translate into becoming like hyperplasia in the breasts? You know how that works?
The naturopath that we worked with, his theory was what happens is if those emotions are left unprocessed, it's not the fact that you have those emotions. It's the fact that those emotions are unprocessed in the body. In other words, they're stuffed.
They're unprocessed. They're stuffed.
They're stuffed into the closet and forgotten about. They're not taken out one by one and discarded and worked through and fixed or whatever. So it's the unprocessed piece of it that is the most dangerous. And he thought that what happens in the body, since those emotions are processed in the liver and kidney, then What happens over time is that becomes a physical toxin in the body.
Oh, yeah, sure.
So it's not an emotion anymore. It's an actual physical manifestation. And since the liver and kidneys are supposed to be detoxing our bodies and not storing things, where's the easiest place to store that stuff?
Fat tissue.
Fat tissue.
Hello.
And once again, breast tissue is the easiest dumping ground for any kind of toxin.
Wow.
So that's how it shows up in the breast tissue, and of course, any toxin in the breast tissue is gonna morph into something else.